Hello! When it comes to your child's health, I know there's nothing more important than getting a clear picture, especially when you're talking about their heart. So today, we're going to dive into how doctors can get an incredibly clear view using some really advanced and, most importantly, safe imaging.
It's the big question, right? The one every parent has when they hear their child needs a heart exam. How is it even possible to see something so complex, in so much detail, while it's literally beating inside their little body? Well, the answer is pretty fascinating. And the best part is, it's very, very safe. So let's get into how it all works. All right, here's our roadmap. We'll start with the tech itself. Then we'll look at the two main ways doctors can get a peek at the heart. We'll also cover why a doctor might recommend this in the first place, and probably most importantly, what you and your child can actually expect. And we'll wrap up by talking about the expertise that makes all the difference.
So, let's jump right in with the technology that makes this all possible. It's truly a remarkable tool, and honestly, a game changer in pediatric cardiology.
The fancy name for it is echocardiography, but the idea behind it is actually pretty simple. It uses sound waves. That's it, just sound waves, no radiation, to create these amazing, detailed, moving pictures of the heart. You know how ultrasounds are used during pregnancy? It's the exact same idea, just focused on giving us a perfect look at the heart's structure and how it's working.
Now, when it comes to getting these images, cardiologists basically have two main windows to look through. You can think of them as two different camera angles to get the perfect shot. They're called TTE and TEE.
Okay, so here's the difference. TTE, which stands for Trans Thoracic, is the one you'll see most often. The images are taken from outside the chest. It's totally non-invasive, but sometimes doctors need an even closer look. That's where TEE, or Trans Esophageal, comes in. For this one, a tiny probe goes into the esophagus, which sits right behind the heart, giving this unbelievably clear, up-close view. So that brings up the next question, doesn't it? Why would a doctor recommend one of these tests for your child in the first place? What are they looking for?
Well, it's all about getting answers. It could be to check out a heart murmur, or maybe an unusual rhythm. Or if a condition is already known, it's a great way to monitor it. It's also the best way to get a definitive look if a congenital heart defect is suspected. Plus, it's crucial for seeing how well the heart's valves are working, for checking in after a surgery, or even to look for things like infections or clots. It's really the gold standard for diagnosis.
Okay, this is probably the most important part for any parent. What is this actually going to be like for my kid? And the good news is, the whole process is really designed from the ground up with their comfort and safety in mind. Let's start with that common one, the TTE. Honestly, it is so straightforward. Your child just lies down and gets comfortable. A technician will put some cool gel on their chest and then gently move a small probe, it's about the size of a microphone, across their skin. That's it. The whole thing is usually done in about 30 to 45 minutes, and it is completely painless. And what about this number? What does it stand for? This is the amount of radiation your child is exposed to during one of these procedures. 0. Absolutely none. It's just sound waves, which makes it one of the safest ways to see inside the body, especially for kids.
Now, what about the TEE, the one that gives those incredible close-up views? Again, comfort is priority number one. To make sure your child is totally relaxed and stays still, a specialist usually gives them some light sedation. Then, that tiny probe is very gently guided into place. And you can be sure that throughout the entire test, a whole medical team is right there, closely monitoring your child to keep them safe and comfortable.
So understanding the procedure is a huge relief. But, real peace of mind, that comes from knowing exactly who is performing the test. Confidence really does come from expertise.
And this is exactly why the team matters so much. When you go to a specialized pediatric center, you're getting cardiologists who only focus on children's hearts. They use the best state-of-the-art equipment, and just as important, they know how to have a gentle, kid-friendly approach. It's not just about getting the perfect image. It's about creating a calm and reassuring space for your whole family.
In the end, it really all boils down to this. The whole point of the technology, the different procedures, the expertise, it's all to provide clarity in every beat. It's about turning uncertainty and worry into a clear understanding, which is always the most important first step in any plan for your child's health. So we'll leave you with this thought. Once you have that clarity, once the picture isn't fuzzy anymore, you are empowered. You have the information you need. And that lets you ask the biggest question of all. Now that you have this clear view of your child's heart, what is the very next step you're going to take together on their journey to health?